It is 8:45 in the morning, and you can join us on Facebook Live this morning as we have another installment of Meet the Doctor from the Indiana Regional Medical Center IRMC physician group, and we're so grateful to be able to meet this doctor who is new to Indiana, and all I need to do is scroll down and get the information. Annie, where's this information? Oh boy, this segment is really starting off well, isn't it? Oh, gracious. All right, so let's meet Dr. Rohit Mehta. How did I do on the name?
Perfect.
Really?
Yeah.
Wow, I'm so proud of myself. An ICU physician at the Indiana Regional Medical Center.
That's correct. Pulmonary and critical care.
Okay, so tell me what that means in terms of ICU, because I imagine it means something different from someone who doesn't work in the ICU.
That's correct. So we have to gather their history. Usually it's from the patient's families. They're very helpful. But in an outpatient setting, you get to know the patients, get to develop a relationship, and figure out over time how they feel about treatments and how they look at different aspects of their disease. And so it gives a little bit more time to explain and to develop our understanding.
Yeah. So when you are meeting that patient for the first time in ICU, what are some of the initial things that you need to know before you decide on a course of action with them?
So in critical care, it's a little bit different process where you initially ensure the patient is stable. That'll mean either from a lung perspective, making sure they're breathing okay. If they're not, try to help them with different machines, put them on a respirator or a ventilator. The other primary aspect of critical care is making sure the person is hemodynamically stable, which means the heart is functioning appropriately, the blood pressure is within appropriate range. So once you ensure the patient is stable, you address all those concerns, acute concerns, ensuring the patient doesn't deteriorate. Then you gather more information, more laboratory workup, just a routine workup in hospital. And then get more information from family, from other colleagues if the patient was in hospital already, and then go from there.
I would guess that it's very, very critical that you know exactly what sort of treatment they have had when they're in that acute situation, because
Sure.
obviously once they get to ICU, someone else has been working on them and has brought them to that point where they meet you.
That's correct at times. At times they may be on a general medical floor or a telemetry floor, and they may deteriorate from either the underlying condition they came in with, or there may be a new scenario that has developed all of a sudden. When patients usually come into hospital, they are ill. They're ill from the primary problem they came in with, but it doesn't necessarily mean something else may not go wrong, especially for certain ages of a population. So you do have that time, and you can develop an understanding of what was happening over the last few days. However, when somebody comes in acutely ill and they're very sick from home, then you don't have that time. Then it's the main aspect of care at that point is making sure they're stable.
We're talking with Dr. Rohit Mehta today. ICU is where he does a lot of his work, but then the office hours, and you are able to meet patients, and it's not quite the critical care situation, and you're able to develop a relationship with them right from the very start. That must make a great difference in the way that you care for them, or the methods that you can use.
Yeah, in an outpatient setting, you have more time to obtain information. If I'm comparing imaging, I have time to get past images from different hospitals, different institutions, get different records, and then compare what I need to do to what was already done in the past. It gives me a little bit more time Usually those patients aren't acutely ill, and so you have some time to get testing and then go about the appropriate treatment once you've gathered enough information.
So you've been in IRMC for how long?
It's about 9 months.
9 months?
9 months, yeah.
And where did you come from?
I came from Peoria, Illinois. I'm actually originally from Toronto. I was born and raised in Canada. So I trained, went to a college in Canada, completed university there, undergraduate, and then came to University of Pittsburgh here. I did my internal medicine residency, and fellowship was done, extensive training in Chicago.
That always interests me when you've been to the really big city hospitals. I mean, you're talking Toronto, Pittsburgh, Chicago. You're talking top of the line, and then you come to IRMC, and obviously smaller and a whole different setting. But what's it like at IRMC? And maybe not in comparison to them, but in comparison to your experiences there.
So I've worked in large institution, medium-sized, and smaller hospitals as well in the past. Even in the cities, they have smaller hospitals where we did rotate as well and go and work. The pleasant thing about cities this size and hospitals this size is you can bring a lot of new ideas, new treatment options, different standards of care, and implement them in these regions. So that's always it's not challenging, but it's actually refreshing to be able to do that and to be able to help not just the hospital, but also the community as well. There's a lot of elderly patients here as well, and going to larger cities, traveling 1 hour, that's just routine travel, and then in traffic much longer, parking. So, trying to take that headache away and keeping them here in the city and helping them out. So it's.
And your wife is here as well, and she's a physician, OBGYN?
That's correct. Yeah.
Yeah. And she came with you to IRMC at the same time?
Yeah, that's correct. Essentially the same time. Yeah. Yeah.
So we brought the Mehta team with us here too.
Exactly.
So at the end of the night, when you go home and she goes home, do you compare cases and you say, "Oh, I had a tougher day than you," and she says, "Oh no, how many babies did you bring into the world today?"
No, we tend not to speak about work too much. We try to keep home stuff at home, and yeah.
The community as a whole, what's the experience like for you here?
Well, it's great. A very nice area. Other than the raining quite frequently here. but otherwise, it's very nice. Nice small community, little things to do, and it's a great place to raise children. Yeah.
We don't generally talk about that rain too much.
Oh, okay.
Because it didn't used to be that we got this much rain as we have in the last 4 or 5 years. But it's been a different sort of weather thing. But it's always interesting to get people's impressions of coming into this community after having been in others, just to see what they like about living here.
Sure.
And of course, the travel that you mentioned, it must just make a tremendous difference for you. In terms of being able to get there and not having to deal with all of the traffic headaches.
Oh
in
yeah,
a
there's
big
no
city.
question. Yeah, it's much easier to travel, and when it's a 15-minute drive, it is a 15-minute drive. When it's a 15-minute drive in a city, it's maybe 40-minute drive.
Yeah,
it makes a big difference with traffic. And
IRMC had a major upgrade in their ICU facilities just a couple of years ago. Tell me about that and working in this particular facility. What's it like for you?
I'm not too sure what was present before, but I can comment on what we have, and everything is excellent. I mean, we're up to standard of care. We recently got a few more pieces of equipment, which helps the physician at the bedside as well. So I think everything is appropriate and adequate, and for myself, coming from a university setting, I have no problem implementing care, essentially.
Well, that's wonderful.
Yeah.
It's wonderful. We're talking today with Dr. Rohit Mehta, who works in the ICU at IRMC, pulmonology and critical care, but also you keep office hours in Indiana and in Blairsville. And that's interesting too. That's a nice facility in Blairsville, isn't it?
Very nice.
Yeah. So tell me about how people might come to use your services in an office setting.
So in an office setting, anyone with any excessive coughing, shortness of breath, perhaps shortness of breath on exertion, gradually developing, pre-diagnosis of underlying lung condition where they need routine follow-up, or something they may have just been mentioned to about regarding a possible problem. Any of those kinds of problems with a pulmonary disease, they can make appointments, and I can see them and help them work out what the condition actually is, confirm the condition, and treat it if need be.
In past decades, when there was so much coal mining going on around the area, there was a lot of black lung in this area. I don't know if it's to the level that it was then, but obviously there is still black lung in this area. There's still coal mining going on, even though conditions have improved, working conditions that would help them to forestall some of that. But what are some of the lung conditions that I don't know if they're endemic to this area, but certainly are more prevalent in this area? Are there some?
In terms of increased prevalence, I can't really comment on that, but I can definitely tell you nowadays there's quite rigorous testing, as you know, in the coal mines. So if they do catch something, they will catch it within the coming years in any employee that's working there. So that's usually targeted. What I'm seeing here is, as you mentioned, folks that have worked in coal mines in the past. They're of course retired by now, or they're at age of retirement, and in those patients you see findings of underlying interstitial lung disease, which normally is known as just scarring in the lung or pulmonary fibrosis. You could see different types of emphysema as well, different types of other lymph node changes as well. So these are things that develop over chronic exposure, and really we're just catching the late end of it at this point, or that's what I'm seeing so far.
Yeah. Okay. Well, it's been very good to meet you here on Indiana in the Morning. If folks want to learn more or wish to set up an appointment with you, is there a phone number that they can call?
Yeah, if they can call our call center. It's 1-888-452-IRMC, or they can also go on our website, irmcdocs.org, and they can make an appointment there as well, online.
Dr. Rohit Mehta. Very good to meet you.
Okay, thank you. Thanks for having me.
It's our pleasure, and thanks for coming in. It is the voice of Indiana County, WCCS.